And so this is Dr. Caroline Pankhurst. She's a trustee of the charity, the Fungal Infection Trust, who do a lot of supporting us here at NAC. They do a lot of supporting MFIG as well, and they support other organizations around the world, a lot around aspergillosis, but they also support other charity research as well. So this lasts about just over 20 minutes, so I'll just switch it on.
And thank you very much to Graham Atherton for inviting me to speak to you today about getting to know Fungal Infection Trust. Now, if you've looked at our homepage, you would have seen that our mission statement is working together to improve awareness, treatment, and patient outcomes for all of those affected by fungal diseases. Some of you may have seen this on the BBC News app at the weekend, and I couldn't resist sharing it with you. And the headline here is, "Could a fungal pandemic turn us all into zombies?" Now, fungus they're talking about is real, but the pandemic is fictional. And the article was about the new hit HBO series called The Last of Us, which is about a fungus that invades the human brain and turns the poor victims into cannibalistic zombies in order to get itself transmitted. And hopefully this raised awareness of fungi will alert people to the real silent global pandemic that's going on. So globally, over 300 million people of all ages suffer from serious fungal infections every year, resulting sadly in 1.35 million deaths. And these examples here I've taken from the Gafi website, which is a global action fund for fungal infections. And they've highlighted a few key points. 1.4 million eyes are infected every year by fungal infections. Now, this isn't common in the UK, but is common in tropical countries. And for many of these people, they will lose the sight in those eyes. 130 million school-aged children in Africa are infected by the fungus Tinea capitis, which causes scarring of the scalp. And even though this is obviously much less serious than the infections in the eye, for those individual children, it will affect their self-esteem and self-confidence. And so this is very important. Finally, the example of chronic fungal destructive lung disease. And this affects approximately 3 million people worldwide. And in countries where infections such as TB are very common, the symptoms can be mistaken for TB. And this results in over 80% of people being dead within 5 years because they didn't receive the correct treatment, because no diagnosis was made appropriately. If we look at the UK, allergic bronchopulmonary aspergillosis is estimated to affect about 100,000 people in the UK. Now, this is a similar number to the number of people living with HIV/AIDS. And if you asked anyone in the UK, they would know about HIV/AIDS, but the number of people that got this condition is vanishingly small. And similarly with severe asthma with fungal sensitization, it's estimated that 500,000 cases occur in the UK, and yet many asthma nurses would have never heard of this condition. So I'd like to introduce you to the FIT people. There's only five trustees, and we all come from very different backgrounds and bring to the job a very wide range of expertise. The FIT was originally called the Fungal Research Trust, and we changed our name in 2012 to the Fungal Infection Trust in order to more clearly represent the kind of work we're doing now, which includes not only giving research grants, which we've been doing since 1991 for fungal, to look into fungal diseases and fungal treatments, but to also reflect all the work we're doing on education. Now, the FIT was the brainchild of Professor David Denning, who's our scientific director, and many of you will know him. Back in the early 2000s, the then trustees and David Denning discussed the possibility of setting up in Manchester a global research centre and also a national centre for treatment for people with aspergillosis. And we were able to fund initial work to get that going. And then it was taken over by the NHS as a national centre and called the National Aspergillosis Centre in 2009. And Manchester itself became a leading centre for research in fungal diseases. And they're both our partners on two of our most important projects, the Aspergillosis and Aspergillus website, and partners on the Microfungi Net programme. So what do we aim to do? Well, advance fungal education, help train scientists in fungal laboratory diagnostic skills, and we've seen how important having appropriate diagnostic skills are around the world. Basic research, both clinical research and fundamental research on fungi and fungal diseases and therapies, to provide evidence-based and accurate information. And this has never been more important in this post-truth world, that people can very rapidly and easily have access to data that they know is reliable. Finally, to raise awareness of fungal pathogens and fungal diseases, not only amongst the general public and doctors, but very importantly, amongst policymakers in the UK and internationally. So how do we achieve our aims? We're still continuing to give out research grants, and we provide a wide range of free online resources. We're very lucky to be able to call on leading international experts in the field of diagnosis and treatment of fungal diseases. And we've developed these teaching resources for health professionals, for scientists, patients, carers, as well as teachers and schools. So you're probably familiar with the Aspergillus website. We also have the FIT Antifungal Drug Interaction Database. Fungal education is delivered through Life Worldwide. And this is a global educational resource for fungal diseases and treatments, and it's available both in English and in Spanish. And this is an online free resource, and it's packed full of expert educational videos, explanatory texts for teachers, students, and healthcare professionals. We have Microfungi Net, and this was created and funded by the FIT, and again is open access, and it's a fungal diagnostic skills course that aims to plug the gap that exists in laboratory and clinical skills in both direct microscopy and histopathology for diagnosing fungal diseases. And finally, there's GAFI, and it's one of our partner organizations, and GAFI is an NGO based in Geneva, and it's an advocacy foundation that pushes for universal access to fungal diagnostics and treatments, including ensuring that fungal infections are represented on the all-important WHO Essential Diagnostics List and Essential Model Medicines List, which are used by governments all around the world to form the basis of their health services. So GAFI is working at a governmental level, and it set this goal that by 2025, to ensure that 95% of people with serious fungal diseases are diagnosed and 95% of them are treated. So this is a challenge to all governments around the world. So where do you find our activities? Well, if you're a patient, the best place to start is obviously with the Fungal Infection Trust website. There's masses of material on there for patients. If you are interested in Aspergillus or Aspergillosis, then go to our website for that. If you want to look at fungal education, then look at the Life website. And if you're interested in what's going on at governmental level, then the GAFI website. So we've learned, if nothing else, from the COVID pandemic, that diseases have no borders, and knowledge should have no borders either. So all our resources and our reach are both global and local. So let's just have a quick look at the Aspergillus website and what it does. So this was funded and initiated by the then FRT, and we've continued to sponsor it ever since by the FIT in 1998. And this is an encyclopedic interactive portal on all aspects of the fungus Aspergillus and the diseases it causes. It's completely free to all users, and it's been supported by unrestricted educational grants, both by the FIT but also various corporate donors and the UK NHS. Now, if you're a scientist or researcher or a doctor, finding something like this is an absolute minefield for you, because it's got over 15,000 scientific articles, and these are added to all the time as new publications appear. And not everyone can get to conferences in different parts of the world. So the possibility of being able to find conference abstracts going all the way back to 1974, which again are always been constantly added to, is again a really wonderful resource. And for patients, a large section has been devoted to them and to their relatives, and attempts to answer most of the questions that people may have and provide up-to-date information. And Graham collects data on where people come from who are looking at the site, and you'll see at the top of the list is China and USA, followed by the UK. But people from all over the world are making use of this site. So we feel it's very important to keep you safe, and so we decided to set up the Antifungal Drug Interaction Database, which is funded by the FIT. We know that therapies for fungal diseases can elicit simple traffic light system of green, yellow, and red. Now, if your prescription medicine is not shown on the list, that means there's no reported interactions in the medical literature. However, it's very important to realize that doesn't mean that you as an individual couldn't have an adverse reaction to the medication, because sometimes these are very personalized depending on what other drugs you're taking in combination together, your own genetics and metabolism. So if that does happen, if something unusual happens, contact your GP. So this can be, the database can be accessed through the website, the Fungal Infection Trust website, or LIFE, or the Aspergillus website. And I've given an example here, and I put in the drug ibuprofen. Now, this drug is available over the counter, and many people mistakenly think that if they can buy a drug over the counter without a prescription, it must be completely safe. And in most cases, that would be the case, but with most drugs, interactions do occur. Now, though the manufacturers provide you with a data sheet, of course, which many people don't bother to read and just throw away, it wouldn't go into the level of detail that you need to find out if your antifungal that you're taking is going to cause an interaction. So if you click on the website, and I've gone in as a patient here, it'll give you the list of all the drugs. Now you'll notice they're in two colors. So the ones in blue, there's been no reported drug interaction. And in yellow, there's 4 drugs there that interact with ibuprofen. It'll give you further information about those drugs because they cause a moderate drug interaction. It'll give you advice on what to do. Now, Graham has developed a really useful app that's free to download. Unfortunately, it's only available on Android phones and tablets. And you can see here the little icon. This is, I've taken a screenshot from my own phone. So if you click on that icon, you get a nice welcoming message, nice hello. And it's very, very simple to use. You just tap on the search icon. And I put in the drug warfarin. Now, my background is in dentistry, and many of the patients that I used to treat would have been on warfarin. And I know that warfarin causes many drug interactions. So this was an important example. And drugs that are very widely used by dentists, such as fluconazole to treat thrush, seemed a good one to try. So I put in warfarin, and I've looked up fluconazole. But if you just swipe along through the pages, it'll give you all the other antifungals that warfarin interacts with as well. Now, unfortunately, it's come up in red, and red means that a severe interaction could occur. And what is likely to happen is it'll increase the effect of the warfarin, and warfarin is used as a blood thinner, so this means that the patient is likely to get problems with bleeding. So the next section will tell the doctor and the patient what needs to be done, so that's monitoring the warfarin level, and then what to do, such as reducing the level of warfarin so that the patient doesn't get problems with bleeding, and then what to do once the patient's completed the course of fluconazole, and what features to look out for, which are signs that something is going wrong. And this case is quite a lot of them, but it includes things like swelling, headache, pain, dizziness, and very important evidence of bleeding, such as nosebleeds or blood coming from the gums. So let's have a look at LIFE, which is our educational arm of what we do. And LIFE aims to provide the latest information on the most common human pathological fungi, the diseases they cause, and their diagnostics and treatment. So a wider brief than on the Aspergillus website. Now, this is primarily meant for healthcare professionals, but can be used by patients as well, and all the information that's on there is written in easy to understand terms. So you might want to find out more about the fungus that's affecting you, about diseases and tests. And this is very easy to look up, and there's lots of information there and data sheets for you to download. There's also an icon that leads through to patient support information, and you'll find there useful link websites and lots of really interesting videos made by other patients about their experiences of treatment and their conditions. If you want to look at the webinars, you can click on our YouTube channel, and that will take you to currently 64 videos. And these have been very widely viewed, and I think over 400,000 people have already looked at these videos and watched them all the way through, and we've had very good evaluations. And there's also a link there to our free fungal microscopy course. Now this we first published in 2016, and it's currently being reviewed and replaced, and we should complete doing that by the end of this year. So the course is open access, it's free, and it's aimed at laboratory workers and junior doctors who are in training. It's available in the most important languages in the world, which is French, Spanish, Portuguese, and Chinese, as well as English. And a lot of laboratories in resource-poor countries don't have access to very sophisticated equipment, but they would all have access to a microscope. And you can make very accurate diagnoses just using a microscope if you've been suitably trained. And these modules take you through an entire course, and the University of Manchester have certified the examinations that end each course, so that somebody working in the laboratory can prove that they've worked to the right level and achieved the right level of knowledge and understanding. And for junior doctors, the Royal College of Pathologists in the UK have accredited this course, and so that they can get continuing professional development points for completing the course. So looking at the research, we're very proud over the last few years to have awarded over £4 million in grant money. And this has gone for both clinical scientific studies and basic research. But the studies that we fund are all trying to help us understand fungal diseases and how they can be treated. We're also very keen to support young researchers with grants that help them grow their careers in medical microbiology. And it's very hard for young people starting out competing for grants with very experienced researchers. And so if we can get them started on their career, it can make all the difference and keep somebody working in medical mycology. And we've had some tremendous successes with this. So about 20 years ago, we funded William Hope, and he's since got an OBE for his work in science, and he's become one of the leading people in the world of fungal diseases research. The FIT also support major conferences which progress dialogue between doctors and scientists with the aim of advancing patient care. Now, just wanted to give you a flavour of the sort of things that we've funded, and 2021 is the most recent year that we got all the data. And from people we funded in that year, there have been 15 peer-reviewed scientific papers being published, and I just picked out a couple of these that I thought might be of interest to you. So examples of clinical work, two of the papers were describing diagnostic performance of the new point-of-care assays for Aspergillus antibody, and two papers related to how the immune system actually kills Aspergillus in the body. And even if you're on treatment, your immune system works with the antifungal drug to eradicate the organism from the body. So it's very important to understand how this happens. And as part of our sort of global reach, we also funded burden of disease estimates in 6 countries, including Democratic Republic of Congo and Indonesia, both of which are not only very highly populous countries, but also countries with high levels of fungal disease. And this can be used to support the work of Gafi and Life Internationals. So who benefits from FIT activities? Well, of course you do, but also indirectly you'll benefit from parts of the website that are aimed at doctors and students, but also patients' families and carers have also found the site very useful. And we've been able to fund things like Poets in Residence, which a lot of patients up in the Manchester area have found really very helpful and enjoyed the work they did with them. We're hoping to do more of that in the future. And we think it's very important to teach school children about fungal diseases. And we've funded a number of projects for school children, including an art competition. And one of the new initiatives that we're starting is a patient advocacy group. And this is work in progress, and the aim of it is to enhance and improve patient user experience of the FIT website, and in the future to aid in the evaluation of the research studies that we're intending to support. So I hope this has made you want to get involved with the FIT, and one of the best things you can do is, of course, make full use of all the information and videos that we have on our website. Tell your friends and families about the FIT, and particularly for people who've been recently diagnosed, this can be really a good support for them. If you're thinking of decluttering your home, and we're all being asked to do that, you might consider selling the items on eBay for charity and donating some or even all of the profits to the FIT. If you're feeling energetic, there's loads of fundraising ideas on the website. And just to give you a couple of examples, Graham himself is currently cycling from the distance from John O'Groats to Land's End on an exercise bike from his home. So you might want to get involved and support Graham on doing that. Or you might want to do something that's fun for all the family, such as organising an Easter egg hunt. And everyone likes the idea of finding a clutch of Easter eggs amongst the mushrooms. So many workplaces like to adopt a charity every year, and why not suggest they adopt the FIT? And you can reassure them that 95 pence or more in every pound that we raise goes directly to fund fungal research grants and educational programs. So do tell us about your events if you do decide to run something, because we can help you with that, particularly with the online fundraising page, and we use the organisation Just Giving to do that. And we can also advertise all your efforts on our networks, on our Twitter feed, on our Facebook page, and on our websites. So thank you very much to everyone for listening today, and I'll hand you back to Graham Atherton.